Welcome everyone. Thank you for being here today. For those of you I haven't met, my name's Albert Wright and I have the privilege of being the CEO of the West Virginia University Health System. And just for one day, I want you to forget everything you've heard about avoiding large crowds. Okay? But you know, we started preparing for this day, 4 or 5 years ago when we purchased 37 acres here in the Gateway Connector section of Fairmont, and we built this beautiful facility. And we started to prepare for, how do we make sure as the academic health system of the land-grant University of the state of West Virginia that we always take care of our communities, and Marion County is one of our communities for sure. And we started to work with the governor's office over the last 4 to 6 months as we started to hear about some of the potential, changes occurring at Fairmont Regional Medical Center. And then, 30 to 60 days ago when we found out for sure that the hospital in town was going to be closing, we started to really kick our plans into action to make sure we're able to meet the needs of the community. And we took that very seriously. And the other person that took it very seriously was Governor Jim Justice. And Governor Justice immediately had Dr. Gee and myself come down to the governor's mansion and meet and talk about what we were going to do here in the short term and in the long term. And we had good plans. The governor had bigger plans than we did. And I remember being in his office, and he put his arm around me, and he said, Albert, we're going to come up with a short-term plan to make sure we meet the needs of the community, and we're going to think big in our long-term plans. And we're going to think real big about making sure we have spectacular health care in Marion County, and we're going to think real big about moving some of the projects you were thinking about doing in W Medicine into Marion County to make sure we have lots of jobs in this county. So I am thankful for everyone to be here today. I'm thankful for for Governor Justice's vision and insistence that we're here today, and we've got some big announcements for you. So welcome, Governor Justice.
Well, Albert is kind in his words, and we have our great President Gordon Gee here with us. Let me just say this. I came to Fairmont Regional, and I sat with senators and delegates and lots of really concerned people. You had a real problem. You had somebody that had been there for 6 years in Electo, and they can't make it. And so they're leaving. And it's going to leave everybody upside down. 20,000 emergency room visits. It's leaving everybody upside down. Now, before that, we had already done a whole lot of work to try to do anything and everything we could. And right now we've got senators and delegates here and a lot of concerned people. In doing this, my vision was really just simple as mud, and that's all there is to it. I'd like to mention Mon General before we go any further, because we welcome Mon General, and they're doing great work, and they're doing great work in our state, and we're tickled to death with what they're doing. They couldn't get us where we needed to go, and just to tell it like it is. The great part about WVU is they're doing phenomenal stuff all across our state and all across this nation, all across the world. But the other part is just this. Just to tell it like it is, and I think Albert and Gordon, which are both really good friends, would tell you that I surely pushed them. I pushed them to the limits of beyond the limits. I didn't really have to push really hard from the standpoint of one thing, because they wanted goodness here. They want that. Now, with all that being said, here's where we could have ended up. We could have ended up just this. We could have ended up in a situation to where that hospital closes, And as that hospital closes, then we have basically a 10-bed emergency room holding area that we ship people off all over the place. That's not good enough for me, and it's just not. It's really not the answer that we want to have in any way. Now, at the end of the day, it's taken a real life effort to get to where we're going to land. And where we're going to land is here. You know, the hospital that we have right now, we all know has lots and lots of issues and lots of problems. It's an older building, and that building surely is in need of lots of repair. It has a group that we should give lots of credit to. They've been in this community for 6 years, and they tried, and they can't make it. There's equipment there that we can probably get by with, but that equipment has a multitude of liens and issues that make it difficult as well. So now let's just think, where are we going to go? What are we going to do? I mean, this problem was a big problem. And you know, from my standpoint, I pride myself like crazy in being able to solve big problems. But this was a big problem. You know, you could take over the building, but you may not be able to take over the equipment. And then maybe you can take over the building and maybe you can't. And maybe you can get that done before somebody leaves, and maybe you can't. There's all kinds of issues. Mon General was good to work with us and everything, and so was WVU. The biggest factor of all with me is just one thing. 7th largest city in the state of West Virginia, and you're not going to end up with a full-service hospital. I just couldn't believe it, and I wasn't going to accept it. And so, at the end of the day, WVU, as they've done many, many times, they come riding to our rescue. And you know, now I've got to admit, you know, I've probably pushed them a little bit along the way, and maybe pushed them a lot. But what we've decided on is just this. We're going to continue to run the existing hospital, maybe in not as big a way as we have. But now keep in mind, the existing hospital today is probably running on 55 beds. It's a 207-bed hospital, but it surely has not run on 207 beds forever and a day. Today, if we had really and truly a 75-bed hospital operational, it would be great. It would probably employ more people than we have there today and is working there today. WVU has agreed to do just this, and that is build us a new hospital. Build us a new hospital that's going to take 18 to 24 months to build. It'll be a full-service hospital, a 100-bed hospital that will employ in excess of 500 people. And not only will it do that, it will have in it the newest and best of the best for all of our people. Now, along the way, there's going to be some bumps and bruises and some pains and everything else. You know, and by that, I mean just this. You know, if you're wanting to have a colonoscopy, and I'm not going to go into details that I used before, so y'all don't have to worry about that. But if you're going to maybe have to have a colonoscopy, from the standpoint of the equipment and everything else, maybe it's better that you have to be inconvenienced to drive, 20 minutes to have your colonoscopy today, and still have all of your emergency care and everything at the hospital until we have the new hospital built. Like I said, there'll be some bumps and bruises, and everything till we get there. But without any question whatsoever, you and Marion County deserve just what we've got. A brand new hospital. But we'll get through the next 18 months, and we'll still provide emergency care and everything at the hospital that we have now. But we'll transition in those 18 months, and we'll transition to a brand new hospital. And all the thanks in the world, for me, needs to be to our partners here. And the net of the whole thing is one thing. And I wasn't going to do it. I wasn't going to turn loose of one thing. And that is just this. You can't stand to not have a community full-service hospital right here in Marion County. The idea to put people in bed, to put people in ambulances or whatever and move them around and everything else wasn't satisfactory to me. And so I hope and pray that you are as delighted as I am and as excited as the WVU people are in what is on the way. So what's on the way is right here within 2.2 miles of the other hospital, something that's going to be phenomenal. And in the meantime, we're going to continue to work there, and WVU is going to continue to work right there, and everything to make the transition as just as seamless as we possibly can. Now, I'll tell you this. Now, here's going to be one of the bumps. It's going to take, there's going to be a bridge period of transferring of CONs and transferring of records and getting everything in place where we're going to probably have 30 days that we're going to be non-functional. Now, beyond that though, we'll be functional at the older hospital until the new hospital's up and going. But I'll turn it back over to Albert and Gordon now and tell you that you should give them a giant round of applause because there's something on the way that's going to be really good.
Thank you, Governor. Let me just point out, first of all, that I'm 5'6" and weigh 150 pounds, and the governor is a little bit bigger than me, and he wins every damn time I get that we have any kind of discussion. But the truth of the matter is this was something that we wanted to do, and the governor's vision was big. He's a big man with a big vision, and his ideas are really being fulfilled here today. So to the people of Marion County, we're honored to be here. There are 1.8 million West Virginians. Your public land-grant university believes that it has responsibility for every one of those citizens, no more so than right here. Even though we're in the shadow of two of our big hospitals, you need to be able to have great health care here that can be immediate, can be world-class, and can provide the kind of security that we need to have in our communities, and that's what's going to happen, and the governor has made that happen. I want to thank him for that. I also want to thank, we've got delegates, we've got senators here, we've got a lot of our hospital people here who have made a real difference. I want to thank my friend Larry Puccio here, who has been very instrumental in helping us think this through. So this took a village. It took a great leader. It took someone who would not take no for an answer, and that's what we have today. I am very proud of what we're going to do here, and this is going to be a state-of-the-art opportunity for all of us. So, Governor, thank you very much for letting us be part of this. Appreciate it.
Well, listen, this was a tough problem. Kind of like this terrible potential monster virus that we could all encounter. I would emphasize to every last one of us, whether they be our senators and delegates, Larry Puccio played a great big role here. WVU is phenomenal and everything. You know, now we're on a pathway to doing something that is unbelievable. A brand new 100-bed hospital. A 100-bed hospital, honest and true, you know, they really in their heart believe it's going to employ 600 or 700 people. But a 100-bed hospital, if we could run on 100 beds at Fairmont Regional right now, we would absolutely have a lot of people working. And that's wonderful. That's wonderful news. But let me just tell you just this. We got a problem right now with this virus, and it could potentially be bad. Now, the net of the whole thing is we have got to have our rural hospitals all over the state. We have got, and we today have got to pay attention to what we do and just recognize the fact that try not to shake hands if you can avoid it. Try to stay away from big crowds if you can avoid it and everything. But at the same time, really and truly know that we're all over it and our health officials are really working hard and they're doing a really good job. We did have a great state of preparedness, and now we've moved into a situation of proactiveness, and we're on it. We do not have a confirmed case of this virus in the state, anywhere. We have now tested 12 people, and 11 out of 12 have tested negative, and we have one still pending. But it's coming. It may be right here, right in this building right now. It's here. We know it's here. But just maybe it's in a young person. It's not even hardly affected. But trust me, our elderly are really exposed to this virus because all viruses attack something. Some attack the kids. Some attack, the pregnant women. Some attack the elderly. And this one is zeroed right in on the elderly. So you've got to be really careful. Really careful. Canceled schools, canceled the state tournament, big decisions, hard decisions. But really and truly, I don't want you to be afraid. I want you to continue to live your lives, but we're trying to do the smartest thing. I told the people in Charleston just this, and then I'll be quiet. I had a lot of people that were telling me maybe it's the best thing to keep the schools open. And a lot of people that were telling me, whatever you do, you can't do that. And at the end of the day, there was three things. And I hope I'll remember all three of them. But the first one was just this, is how are you going to live with yourself if this thing breaks really bad? How are you going to live with yourself if all of a sudden we have multiple senior citizens that we've lost? And then you're going to say at that point in time, well, hold on, let's close the schools now. I don't know how you answer that question in a positive way. The other thing is just this, is in our schools are our teachers. And some of them are past 60 years of age. And those are the people that really, at the end of the day, are teaching our kids and bringing us the goodness of education in every way, shape, form, or fashion. And we're going to tell them, no, it's okay. You go just be in that situation. I don't know how you do that. And the other thing is just this, is if it was just a matter of days and you were going to have to close the school, somebody came to you and said, Governor, what about this? If we think we're going to probably end up closing in a week or 4 days, you can't wait. You just can't wait. So I would tell everybody out there, everybody, now it's our responsibility to take care of one another. Now it's our responsibility to rise to the forefront and really be West Virginians that really know how to take care of each other. Do that. You've got people out there that need another warm meal. Well, help them, for crying out loud. The last component that was really big with me is having the assurance that our schools that are safe havens for a lot of our kids, or a place to get 2 meals a day for a lot of our kids, that we were still going to be able to provide those type of services. And all of our school personnel said we're going to get that done. Now, we need your help in every way. this is serious stuff. And we absolutely, you know, we would hope and pray that it'll pass on by us. But we got to be ready. So today is a fabulous day here. We've got to continue on doing the work and the good work that we do every single day, all the time. But I would caution everybody, wash your hands. Absolutely. Try any way and every way to avoid big crowds, and try any way and every way you can to look after the elderly, because they really need you right now. Whatever you do, I mean, go to the grocery store for them. Do something for them to keep them away right now for just a little while. Nevertheless, I thank you for allowing me to work on this problem. We worked really hard. I think we've got a tremendous solution for a problem that looked like you had Electo that was just going to close the doors and walk away, and you're going to end up with a 10-bed emergency staging area, and we don't need that. So really and truly, again, thank y'all. Thank y'all in every way. God bless you. Thank you.
Al, come back up here.
Okay.
You're good at any questions. I've taken this as far as I can.
Happy to answer any questions today. Yes.
So what does this mean for some of the employees at Fairmont Regional, as far as ones who maybe haven't found a next job or not sure what their next step is going to be?
Good question, good question. Obviously, the hospital's in the process of closing down. We've had a number of job fairs in the community. We've hired a lot of those folks. I suspect we'll continue to hire a lot of those folks, you know, whether it's at our facility here in Fairmont, Bridgeport, Morgantown. As the governor said, there's going to be a brief shutdown in services while we get the new certificate of need, and we also bring in new equipment. Because remember, even though we're going to run a smaller version of Fairmont Regional Medical Center as we reopen it, it's going to have these same electronic medical records, same physicians that we use in the WVU Medicine Health System. So once we get that staged up, we'll start to grow that hospital. And as the governor said, we're going to grow towards this campus. This first phase will not be 100 beds, but if you look at the second phase, you know, because we want to get something up and running as quick as we can in that first, 24 months. Long term, we anticipate a mix of different type of care beds here to get us up to about that 100-bed campus with 400, 500, 600 people working here in Marion County.
And is the plan between kind of now and then to keep Fairmont Regional open, or?
We'll keep Fairmont Regional open. Definitely the emergency department, as many beds are as necessary and we can staff up to move into this facility. Then it will transition right over seamlessly. So as the governor said, we might have a bumpy couple months here, but long term we're going to get it right. And we want to build something that's sustainable for the next 50 years here. Other questions?
Back there in the back, Albert.
Yes, sir.
Given the likely surge of critically ill patients with this virus, is there what are we doing about ramping up the capacity of hospitals in West Virginia in the short run? I'm talking about a few weeks.
You okay for me
Yeah,
to take that first one? So, I'll speak for our health system, and we're working with the Hospital Association and hospitals around the state. I think everybody's creating those plans now as to if you have a surge of sick patients that you need to have capacity for, what are the levers we can pull to create those capacity, either in the form of temporary facilities or halting elective procedures in order to make room for, non-elective sick cases. So I think all of our hospitals are planning for that right now, and watching lessons learned around the world and in other hospitals outside of West Virginia. Because as the governor said, it might not be here yet. It's actually here somewhere. We might not know about it yet, but it is going to come here in some form, and our job is to be prepared.
Do we know when that 30-day down period will be?
You're talking at Fairmont Regional?
Yeah.
I believe the hospital's going to wind down by the end of March, so we are hopeful to be up and running somewhere in the early to mid-May timeframe, if all goes well.
Which may be the peak of the surge.
Unfortunately, maybe the peak of the surge. So we're gonna, between ourselves and the Mon Health system for this area, we're gonna have to find ways to create capacity in our current hospitals.
Albert, would you explain to them while the emergency room is closed, the facility here?
Sure. No, so while the emergency room's closed for that time period, we're gonna start to work with our emergency department teams to look at a number of different levers we can pull to potentially have some ambulances staged at the hospital in case people come. We are gonna look at increasing significantly our urgent care hours in this building. We see about 300 patients a day in this building already, so we'll have more capacity than usual in Bridgeport and Morgantown, but also try to stage some things right here in Fairmont for folks that can't make it urgently to those other sites.
Let me add one thing real quick too, and that's in regard to all the work that our health officials from DHHR to the National Guard to everybody's already doing. You've got a great question, sir, and really, believe me, B, our people are all over exactly just that, because the biggest concern that everybody has is that if you get a surge, that it will task our hospital resources to be able to handle the surge. So think about it. What everybody's doing, what I'm doing with the state term, with the schools and everything, we're trying to elongate the whole situation to where the surge is minimal. And that's the whole, that's everything.
Well said. Yes, sir.
Can you give us some clarity on, I think they said phase 1, phase 2, how many beds you expect at 24 months and
So right now, I expect somewhere in the 25 to 50 range in that first phase, and then long-term, we look at, we're going into a lot of unknowns in Fairmont right now. What is the total capacity need? What is that mix of beds? So phase 2, we got it down there in a ghost diagram with the intent of what does it exactly need to look like. But we want to get something started right away so that we can have, permanence in more full services in Marion County quickly.
But
We're
your
gonna
but your CON
Yep.
is for 100 beds.
Yes,
Yeah.
yes. Yes, sir.
Any comments on what about the medical staff at Fairmont Regional Medical Center?
Some of the physicians already work for WV Medicine. We're working with those folks. We've been meeting with some of the other physicians there, trying to find transition plans for those doctors as to, where else can they practice in the community. Some of them may end up practicing at our long-term at our new hospital here. Some may practice as we reopen. Yes?
Are those 100 beds, are they acute care beds? Are they,
Right now, we're just focusing on acute care beds. Long-term, though, I picture a mix potentially of skilled nursing beds, rehab beds, different things like that. That's what we're working through right now. Right now, though, we're just working on emergency department beds and acute care beds.
Psychiatry?
Not at this time. I think, we've got some other things in the works as to where we long-term take care of psychiatry patients, because that was a significant part of the population at Fairmont. So
Addiction treatment?
we have not programmed the hospital at this point in time, not to that level of detail. We do have those services in the northwest central region, though. Other questions?
Thank you. Good job.
thank you.
Okay, we're done. Thank y'all so much.
I'm not shaking
What do you think? You think it's good? Okay. I didn't want to second guess it, or I didn't want to differentiate the best, but I also didn't want to be unrealistic.
I think that was the right
That good?
hand. I think it's great.
Good.